vaccination program has been halted due to the scarcity of coronavirus vaccines in the country. Last month, the West African nation began its immunization campaign after receiving more 300 million AstraZeneca vaccine through the COVAX facility. Now, due to the global demand for COVID-19 vaccines, Nigeria is currently struggling to continue its plan in containing the spread of the virus.
We believe that in a situation where we still cannot specifically determine when the next batch of AstraZeneca vaccines will arrive, then I think wisdom only dictates that it's better for us to vaccinate people fully, and so that we can say that we have a pool of citizens that have been fully vaccinated, since this vaccination comes in 2 doses.
Nigerian health authorities announcing plans to halt the COVID-19 vaccination program. The country rolled out its mass vaccination campaign in March after receiving 3.94 million doses of the Oxford AstraZeneca vaccine. That's just enough to vaccinate less than 2% of its over 200 million population. But a high global demand for the vaccines has led to delays in the supply of the jabs.
Second delivery of this AstraZeneca vaccine is not very is not confirmed yet as we expected, because we are expecting that before June or by June we should have the second delivery. You know, the third phase in quotes in Europe and Americas and UK, you know, is making the demand. In India itself is making the demand for the vaccine to be very high, and prioritizing. You like these vaccines to go to where the virus spread and the disease are increasing. So because of that, Nigeria, you can see the numbers are getting down, and we are not experiencing the third phase yet. So they don't take that Nigeria as being a priority for down. So that may delay the supply.
The nation just went through the second wave of COVID-19 and has succeeded in containing the virus. No COVID-19 related deaths have been reported in nearly 2 weeks. The vaccination program is at the core of government's plan to stop the spread of the virus.
The first phase implementation is 3 months. That is from the time you take your first jab to the time you take your second jab. That is when the first phase ends. So to 3 months' time, this same cohort will have their second dose heralding the end of the first phase. Arrangements have been put in place, and Nigeria now is on the priority list that the delivery of the second batch should occur. So it will come in such a way that it will not compromise the trend that we have already established now.
The government plans to vaccinate 40% of Nigerians by the end of the year and 70% by the end of 2022. The country is expecting an additional 41 million vaccine doses through the African Union, and health authorities hope there will be no further delays and setbacks in the rollout of the vaccines.